I'm the site director of the, how do I do this? Okay, all right. I'm the site director of the UCLA CTSI here at LA Biomed Harbor, and I work with Dr. Wang and Dr. Mangione also on the training programs. So I am going to tell you really very, very briefly what the CTSI is, and then what the CTSI has bring to our institution since we have been working together from the year 2011. So CTSI has this big mission to bring biomedical innovations to bear on the greatest health and the need of Los Angeles, because Los Angeles is one of the largest and the most ethnically and socially economically diverse counties in the United States. I have a problem. How do I move this forward? Okay, and these are the aims of the UCLA CTSI, and for us, the most important is to prepare for the translational workforce and to conduct high-quality multidisciplinary team science. And this workforce development include the development of investigator and the team of people that will be working with you. So this is what Dr. Mangione's goal is to develop a translational workforce, and because we believe that multidisciplinary team science is the way to go forward so that you can get bigger grants, be part of the team, so that the translation of what is discovery in the bedside can go from the bench and go to the studies quickly, to clinical studies quickly, okay? This is a complicated structure of the CTSI. You really do not need to know, except that we are in the workforce development area, here, where the K Awards is under this, the K workshop is under this, and you'll meet Dr. Wang in a few minutes, I'm sure. Now, how do I do it? I can't get this going. So I'm going to tell you in the years from 2011 to 2017, when we start working together, what the Clinical and Translational Science Institute brought to LA Biomed and Harbor-UCLA. And the most important thing is that we learn about the science of community engagement and research and interest in implementation science. So what we have done in the past few years is to engage community representatives as members of our local scientific advisory committee. We have a core committee to direct the activity, the research activity. We develop a small seminar series so that everybody get together and learn what it is. And we have partnered with the community organization, including the African American Healthy Families and the Pacific Islanders and Native Hawaiian Alliance, and we organize community symposium on obesity, which is the interest of the community itself, and precision medicine as a method of dissemination of what the science is going to. And we also conducted town halls to see how we can engage community. And the success story came, okay. How am I going to go? The success story came here when Bowen Chung, who is a child psychiatrist, and was supported by our LA Biomed CTSI on something called building resilience in increasing community hope. And this is really for the treatment of depression and reducing disparity in depression. And with this pilot grant, you can see the pilot grant, he then will obtain a $2.5 million grant as co-investigator with Dr. Ken Wells, which is shown in the figure there, from UCLA. And also he became the part of the Patient Partner Participatory Research Network, so-called PPRN. And you can see that this is important, and they were awarded the Team Science Helping You to Help Community Award in 2015. And the more important is that the Department of Mental Health added this as a way to help of the strategic plan to help patients with mental disorders. So these are the other things that the CTSI brought to LA Biomed. The different investigators here locally, they were able to obtain grants in one way or another. And I think that this may show that just starting new and getting into new, go and apply for grants and you get funding. And this is community engagement and research. Okay, the second thing that CTSI have and still have is the offer to investigators like yourself technology voucher program. You can apply for $10,000. It comes every year, and the priority is given to young investigators. And you can see that we for example, this two not young investigators, Dr. Phila, that some of you will meet this afternoon, and Dr. Ibrahim, and the two of them work on this and publish this in the Journal of Clinical Investigation. As you know, it's one of the premier journals of medical research. In addition, CTSI Voucher Program also funded Dr. Dixon, who is an expert on mucopolysaccharidosis, and many other people, including young investigators as like Dr. Chow, and enable them to get grants. So this is something that is geared for young investigators, and when it comes out, make sure that you go and apply for them. Then what did the other thing we do here is that we support clinical research. And this is a clinical and translation research center that help especially young investigators. And the voucher program is coming to help you to translate what you discover in the lab into the first in man studies. And this shows that we were supported, myself and Dr. Swallow were supported on this grant, and then the publication came out last year in New England Journal of Medicine, and next week we have 4 publications in JAMA coming out from these things. This is another investigator that was supported by the Clinical and Translation Research Center, Dr. Casaberry, resulting in applications, publication in New England Journal of Medicine, and funding from the National Institute of Health. This is Dr. Da working on HIV, and again, a publication in JAMA, and also funding from the NIAID. So the other thing is that we are very active in providing CTSI Informatics support for cohort finding and database management, and we have gone a long way since the beginning of 2011, so that we are able to pull out patient data to help people to find out if I'm going to study lung cancer and what is the importance of non-small cell, how many patients are we going to have, how many biopsy you can do. This is where you can pull out cohort finding, in other words, finding the number of subjects that you have, number of patients that you have that you can, for example, take lung biopsies from. And most importantly, the CTSI provides this KL2 scholars. The KL2 scholar application is due in February, and in Los Angeles Biomedical Research Institute, we have 3 of them. Jenny, and some of you will meet Jenny in the afternoon. She was funded by KL2 and immediately got funded with a K23, which is external funding. And we have Tian and also Priya doing this, and then we have a more senior investigator who also benefited from the CTSI scholars, and he applied for a bridge grant, and with a 1-year bridge grant he got an R01 funding of 5 years to study hormonal mechanism of sleep restriction. So remember, look out to the CTSI website, see what are the things you can get there, funding opportunity and educational purposes. And Dr. Mangione is going to talk about this more.